How do we date a pregnancy? What is your due date? We get a lot of patients come in very confused because they put their last menstrual period into an app and it gave them one date. They did an ultrasound and it showed another date. And then a few months later, they do another ultrasound and it shows them another date. They come in wondering which one is it and does their due date change? Your due date never changes. What we do to date a pregnancy is we assume a 28-day cycle from the first day of your last menstrual period, 280 days from that time. From there, we compare it to an ultrasound, and the accuracy of the ultrasound changes with time. The first ultrasound that shows a heartbeat is the most accurate ultrasound. We will use either your conception date or your last menstrual period date and compare it to the first ultrasound date. Once your due date is confirmed, it does not change. So in the first trimester, when we're using something called a crown rump length, which is basically the head to the rump of the baby, that is the most accurate. I think about it as when you start a computer, the process of starting a computer is the same every time, and then moving forward, people use the computers differently. There's different things that happen during development, including genetics and environment, basically if there's any medical conditions or other things affecting the pregnancy that can greatly change the size of the pregnancy. So once your due date is established, it stays the same, and those relative due dates are basically looking at averages, similar to a growth chart that you see kids use once they're born in a pediatric office.